Hello, I am Leslie Frank. I am a sociologist and the director of the Fed Family Lab at Acadia University. At the lab, we seek to understand better the nature of infant food insecurity in high-income context. And I'm popping in today from Nova Scotia to share some bites from our project funded by the Social Science and Humanities Research Council called Finding Formula, Confronting Insecurities. We used interviews and surveys and a digital ethnography to explore feeding challenges brought on by two main shocks. One, the rising cost of infant formula, and two, the crisis level infant formula shortages that were occurring in North America in 2022 and into 2023. We learned that amongst our survey respondents, that almost half of caregivers were income-based food insecure, and there was many compromises being made to infant feeding. For example, we learned that for those that were breastfeeding, about 50% or half of them thought that their baby was hungry because the mom wasn't eating enough because they didn't have enough money. And 90% worried about running out of infant formula before they had the money to buy more. 47% actually did run out of infant formula without the money to buy more. And about a third actually said that they fed their baby something that they didn't want to because they couldn't afford formula. And also a third said they either watered down infant formula to make it stretch, or they skipped feeding times due to lack of money. And all those things also happened because of infant formula shortages in caregivers' communities. And our ethnography participants shared in depth the amount of work they did to actually access infant formula. For example, and I'm going to read from a bit of a list, they monitored websites, created tracking systems, received formula from strangers online, traveled to multiple stores, to other parts of the country, switched infant formula types and brands regularly, made homemade infant formula, fed solids early, breastfed more, donated breast milk to others, received help from family and friends in networks of support, and offered helps to others. One mother told us of quieting her hungry baby with a sucker. Another summarized well the commingling of affordability and supply chain risks, saying, support for families with children is poor. Maternity leave benefits are low if parents even qualify for them. Access to breastfeeding support is suboptimal, and formula is expensive. The cost of living is high. And all this creates stress and impedes families' ability to feed themselves and their children. Stay tuned for the launch of our project website coming soon, where you'll be able to hear more about food insecurity in early life and caregivers' insights on what ought to be done to prevent it.